Hi everyone, so today I would like to present about motor tics. What is motor tics? So motor tics can be defined as an involuntary movements caused by spasm-like muscle contractions, most commonly involving the face, mouth, eyes, head, neck, and shoulders. There are two types of motor tics, and the first one is simple motor tics. Simple motor tics usually involve only one muscle group or body parts, and it is usually not harmful, but it can be embarrassing or painful sometimes. And the examples of simple motor tics are quick eye blinking, head twitches, head jerks, or sticking out the tongue. For the complex motor tics, it usually involves more than one muscle group or body parts, or it can be a combination of simple motor tics. And usually, this type of motor tics appear to be more slower than the simple motor tics, and it appears as if the person is performing the movement intentionally. And also, this type of motor tics can interfere greatly with someone's daily life, and it can be harmful as well, such as lip biting or head banging. And the examples of the complex motor tics are repeatedly smelling an object. Moving on to the causes and risk factors of motor tics. So for motor tics, it usually begins during childhood and tend to improve during adulthood. However, if the motor tics appears or begins during the teens or early adulthood, it will likely be a lifelong condition. And the motor tics will get worse if the patient experiences stress, sleep deprivation, excitement, heat, or caffeine. Moving on to the diagnosis of the motor tics. For someone to be diagnosed with motor tics, medical professionals will need to review their medical history, and they will need to go through the full physical examination. And to be diagnosed with motor tics, tic must occur for at least a year with no tic-free period longer than 3 months. Next one is the treatment for motor tics. So usually, motor and vocal tics are not dangerous or disruptive. However, for the severe motor tics that can be harmful or painful for that person, it can be managed by medication that include neuroleptics or other sedatives. My last question, are tics related to Tourette syndrome? So basically, for a person to be diagnosed with Tourette syndrome, they need to have a combination of vocal tics and motor tics. So vocal tics happen when a child suddenly shouts or makes a sudden noise. These two types of tics can co-occur, and if motor tics and vocal tics co-occur more than a year, then the person can be diagnosed with Tourette syndrome.